So in order to understand lymphangioleyomyomatosis, number one is to understand the normal architecture of the lung, okay? So basically the lung is like a sponge. So the white spaces here are the alveoli. This is where the air that we breathe in goes into these empty spaces. And they're surrounded by this a very thin alveolar septus. And the alveolar septa basically contains all the lymphatics, vessels, and venules that are needed for a gas exchange. So let's go a little bit on a low power field to show you exactly how the alveolar septus look like. So as you can see here, these are small tiny capillaries that sit in this septus, and they're surrounded on both sides by pneumocytes type 1. So the pneumocytes type 1 are these slightly flat squamoid cells, and they participate into the gas exchange. While the bigger ones, okay, these are the pneumocytes type 2, like this one right here, that actually produce surfactant, which is like a soapy kind of material that prevents the collapse of these alveoli. So now I'm going to show you a picture of lymphangioleyomyomatosis, an old case of mine, which now has basically again a septus, okay, which are very thin septus, but then we have these nodular proliferations along the alveolar septus. Now these nodular proliferations are composed of cells basically, which are spindle cells. So let's pick up an area right here, and we can have this let's see, for some reason yes, these are the cells. Okay, so these are spindle cells, and some are epithelial, some are spindle. They have a very eosinophilic cytoplasm, and they actually proliferate inside the alveolar septa. So basically spreading the cells apart, okay? And this is why they prevent, okay, the gas exchange cannot happen anymore. So that's why this disease is slowly progressing, and eventually in the long term will need a lung transplant. Now, lymphangioleyomyomatosis can be present inside the lung, but it also can be present inside of the lymph nodes, in which case we're talking about a intranodular lymphangioleyomyomatosis. So in order to prove that these cells are smooth muscle, we can do smooth muscle actin and HMB45, which is going to be positive in this case.